One, thank you all for being here today on to learn about an issue that is near and dear to my heart, human trafficking. My name is Jody Emerson. I'm the state representative of the 91st Assembly District, which is Eau Claire, Altoona, and parts of Eau Claire and Chippewa counties. Last year, I served as the vice chair of the Speaker's Task Force on Human Trafficking. I've had the privilege of working alongside many dedicated individuals and organizations to address one of the most heartbreaking issues of our times. Human trafficking is an issue that transcends borders, communities, industries. It's a crime that preys on vulnerabilities, and it strips individuals of their basic freedoms. But it's also an issue that when we work together, we can make a lasting impact and a lasting difference. This symposium is bringing together advocates, experts, educators, policymakers to deepen our understanding of the challenges that we face and explore issues that are going to help protect victims, hold perpetrators accountable, and try to prevent some of this exploitation that is happening. One of the things that is near and dear to my heart is hearing from people who either work closely with survivors or are survivors and thrivers themselves. Because I think it is core to understanding an issue, not just from an academic perspective, but to know what it's like that people who have walked and lived this life, what they have to say. The old saying is, if you're not at the table, you're on the menu. So we're grateful to have experts at the table today to help share their expertise with us. Together, we can and will make a difference in this fight. There was a lot of bills that we came out with from the task force. I think there was 11 altogether. A lot of them revolved around education and awareness and collaboration amongst groups. It's really good to know that we have just about every agency has some piece where they are looking out for human trafficking, whether it is Department of Workforce Development, Department of Children and Families, DPI, obviously DOJ is very involved. But we have raised the level of human trafficking discussion throughout our state and throughout our country. And that's very different than what it was when I first got involved in fighting this more than a decade ago. So we've made progress. Where we are sorely lacking, in my opinion, is the supports that we give to victims, the supports that we give to the organizations who are walking alongside people as they are trying to come back from the trauma that has happened to them. We did some of the bills last year that established a human trafficking council, that there was some awareness for human trafficking posters, some training for various industries who have connections or might come in contact with people who have been or are victims of human trafficking. There's educational programs for grades 7 through 12 on human trafficking. These are all great. There's always more that we can do, and we're not going to stop pushing until we get to a point where human trafficking isn't happening in our state anymore. Thank you all for joining us today. Please ask questions, and just think of this as a time where you're able to increase the knowledge that you have. There's so many issues that we deal with in our legislative offices, and it's hard to know the answers to all of them, and especially in underreported and underrepresented crimes such as human trafficking. But if we can get to the point where we all know a little bit about this, we can really move the needle forward as a state. So thank you so much for your time, and I will turn it back to Senator Johnson.
Thank you, Representative Emerson, for your participation and for your advocacy. Now, to kick this off, we would like to welcome the members of the Milwaukee Police Department's Human Trafficking team. They are comprised of leadership from the Sensitive Crimes Unit, 2 detectives who are federal task force officers, a part-time analyst, and a trauma counselor victim advocate. Each has specialized training to address human trafficking, So please welcome Detective Anna Flores, Detective Michael Walker, Sergeant Fawn Schwant, and forgive me if I mispronounce your name, I'm really trying, and SCD Trauma Counselor Maria Rozak.
Good morning, beautiful people, and thank you so much for letting us be here. Unfortunately, Sarge Fawn had a little incident yesterday, so she cannot be with us today, but we do have a special guest sitting in the back. And it's our partner from Franklin PD. I am going to apologize right away. We are in the process in conducting a recovery operation, so we are going to have to take off. We are trying to recover a young person. So cross your fingers for the results of this operation. We are very happy to be here. We appreciate the invitation. Since last year, we have been very intentional on how we approached what we are doing and how we're doing it. And also, we began tracking our numbers specifically to be able to ask for what is it that we need. So I want to talk to you about our internal numbers a little bit. They have grown since the last time we saw you, but now we're also better in tracking. So we had, for the year 2024, we had 40 referrals, and that includes referrals from CPS, from NCMEC, or from National Human Trafficking Hotline. We created a human trafficking email that we share between the agencies and with other community partners where anybody can send a tip about somebody being trafficked or an address that we need to look into. In 2024, we received 143 emails on leads that we had to look into. We had 44 new cases. And those cases are not just purely human trafficking or child trafficking, but also, for example, child enticement or soliciting children for prostitution. So we worked on 44 cases. We also worked on cases that carried over from 2023, where we were still waiting for example, search warrant returns, or we were able to get people into custody that were wanted at the time. Our analyst was requested to do 99 workups, and that's for the requests were made from DCI, FBI, or other law enforcement agencies. We attended DCI Human Trafficking School, so we were able to make connections with other agencies within Wisconsin, and we saw a huge overlap of the travel between Milwaukee and Sheboygan, Green Bay, Manitowoc, Neenah, Green Bay, because of the location of strip clubs. We also, because we are a part of Sensitive Crimes Division, we do get pulled for another assignments. It's not often, but we were involved in 119 non-human trafficking related assignments, and that includes attending forensic interviews or getting assigned sexual assault investigations or child abuse investigations, attending MDT calls, doing follow-up on cases where there were DNA hits that came back from the crime lab. There's only 2 investigators. As Senator said, we have a part-time analyst. We have one and only Maria. We do rely a whole lot on our federal partners and other agencies, and we're blessed that we're able to get that help. But our challenges remain the same that we had last year. I'll pass it on to them so I can stop talking.
I think you guys muted in that transition. Just heads up.
Thank you. Okay.
Okay. So one of the things that our challenges we talked about last year was a dedicated human trafficking district attorney assigned to the Milwaukee County District Attorney's Office. Currently, we know that our cases get referred in. There are sensitive crimes district attorneys that review the cases, but depending on what week the case gets ordered in, depending what DA picks it up for a charging conference. So it's not a consistent person that would take on these cases. Although they do a fantastic job, they're also spread out doing sexual assaults, child abuses, and other sex-related crimes, including adults and children. We know we did our little research this year. We know that other jurisdictions across the country do have dedicated prosecutors that specialize in human trafficking. And we did have a discussion with the new district attorney as he came in, and he tasked us with doing some research on what agencies do that and what the numbers are. So we're in process of getting that. So there is a discussion. There's a little bit of work yet to do on that, but at least we're talking about it. So that's a positive from last year.
In addition, advocacy is really a very compelling role, and I appreciate that everyone has noted that standing with someone and beside them, someone with lived experience, is such a privilege. And with changes in federal dollars and dollars available to community-based agencies, we have seen a loss of staffing in a lot of different programs. I was fortunate to be a part of a collaborative after-hours support for youth ages 11 to 25 that completely dissolved this year because of the lack of available resources, which is very compromising. It's compromising to the young person if we don't have availability and accessibility. There's also an ongoing need for advocates to be called in on the front end so that the young person or the adult or the person who's experiencing this event can choose whether or not they participate, because the fundamental foundation of advocacy is really to offer people choice. And in a situation where so much power and so much control has been taken away, if that support is available, it can be a gift. So there are a lot of organizations, there are a lot of confidential advocates that are not as present for us. And it is something that desperately we hear from those with lived experience that want advocacy present during interviews, during medical care, and to have them have that support is truly a gift. As Anna and Mike said also, not only have the cases been very intense, but we're seeing sometimes a shift in who the offenders are related to these events. We have had far more interfamilial cases involving family members, an increase in how people are being accessed, even, and we talked about it last time, even through the group homes that we have in the community. They're very long and important matters to investigate, but you also have to have a holding vessel for these people who are trying to move in and out of making choice and gaining support.
And just to piggyback on what Maria said, I know we talked about it last year as well. 50% of all the group homes within our state are in Milwaukee. Those locations haven't changed. We see youth from all over, all other counties and jurisdictions that are being placed here in Milwaukee, and then they're sucked in. The traffickers know exactly where to go. They know exactly where to wait down the block to pick up somebody who's going to walk out. And that's our constant ask and argument, is to relocate the group homes. We have a couple of cases where our youth was placed out of state or in a more remote area, and we see that they have a better success of leaving the life than they have when they're right here down the street. And it's heartbreaking. I am happy that we're having these conversations. I'm happy that there's more people participating in it, and there are people that are open to hear about it. Our goal is to also educate our department on the difference between prostitution and human trafficking, because there's still this perception that somehow women engaged in this voluntarily. So we're trying to break that. And what else? We're happy to be able to be at the table, because I know that it hasn't always been the case. And like Maria said, I think the need for advocacy and for resources is huge, because not only we cannot do that without that holding vessel. It's hard for us sometimes to bridge the gap that we have with other youth or young people and in general, it's hard for them to talk to law enforcement as it is. So having the advocacy and being able to bridge that gap and help us form a relationship is huge for us long term.
And we certainly need more investigators. I mean, I am so grateful for the time, the energy, and the expertise between these two wonderful people and our federal partners. But so much is going on in Milwaukee. And again, as Anna said, we're grateful for the time to talk and educate and be a part of things. We spent a great deal of time with the hospitality industries during preparation for the RNC. But every single group that you talk to kind of unearths and unpackaged seeing more of that need. So today is really a gift for us as well.
Thank you.
Thank you so much for joining us. We sincerely, sincerely appreciate all of your advocacy, all of your work. Your work has been critical in identifying not only the perpetrators, but also helping victims both in the city of Milwaukee and across the state. So thank you so very much for your participation. Next, we'd like to welcome Miss Nancy Yarbrough, who's a social justice advocate, victim, and founder and executive director of Fresh Start Learning Incorporated, based in Milwaukee. So for over 15 years, Nancy has been a champion for diminishing sex trafficking, combining outreach and direct victim services with the efforts to create widespread community awareness. So we are honored to have you here today with us, Nancy. Thank you for your participation, and the floor is yours.
Thank you, Senator Johnson. Certainly appreciate the opportunity to be able to share. Again, I'm Nancy Yarbrough, Executive Director of Fresh Start Learning. We are definitely in a path of setting the record straight that no matter how much we do, there's still more to do, right? No matter how many people that we touch their lives, there's still many more lives that we need to touch. So this symposium and the panel is a good way for us to show what it looks like to work together and for the same common cause. Our mission at Fresh Start is to provide education, empowerment, and advocacy for individuals impacted by trauma, exploitation, and addiction. Our vision is to build a world where survivors are restored and empowered to lead lives filled with purpose, dignity, and hope. Today, I will share insights on the importance of awareness, prevention, and the work that Fresh Start has done collectively with other organizations and to support survivors in our communities. I will be also highlighting the critical role of why housing is so important, training and collaboration to achieve long-lasting change. Again, as Senator Johnson mentioned, I am a survivor. I'm also an author, but I'm a fierce fighter for advocacy and change in policies and the way that we see people to help them not become victims, but become thrivers and survivors outside of where their life had taken them to, whether it was coerced, forced, or whether it was implied, or whether it was a poverty issue that needed to be filled because there was lack in being able to take care of themselves, and that was the means that they saw fit to be able to go into the lifestyle. Awareness, why it matters. Human trafficking thrives in darkness and silence. Awareness sheds light on the hidden dangers and equips communities to recognize red flags of exploitation that takes hold. Prevention awareness and efforts from Fresh Start has been programs like the Purposeful Purse, Living the Sober Life with women who are above 18 that experience life traumas through exploitation. Our Feet on the Street outreach group that actually takes out the Purposeful Purse and educates people that are still making that decision to come in off the street, but also provide dignity in a way that we're taking out hot lunches or bag lunches, resources, and providing an opportunity for them to come in for shower hours and laundry days. much as possible so that we don't pull in front or lag behind, that we really offer an opportunity to let them figure out the nuances of what their life is going to be outside of trafficking. That is one of the biggest things that I like to do from an internal standpoint, remembering when it was me, what did I need? What did I want? How did I want people to address me? What was the intent that they were doing versus the impact that it was having on me? So to be on the inside and on the other side of this is truly amazing. I'm grateful for all the multidisciplinary work that's being done and being at tables to be a conduit of conversation for the youth that are still going through exploitation or coming out the rafts of bondage, as well as adults, to be able to be their voice at the tables where people are trying to figure out their lives going forward. There's nothing like having a lived experience person at the table, no matter what kind of touch points that you have with someone coming out of exploitation, because we mean well, but sometimes our intent is not impactful like we think. We harm more than we help sometimes. Safe housing is essential to breaking the cycle of exploitation. It provides the survivors with stability, safety, and a safe place to heal. But housing is not the only component, it's not the end all to be all. We can't place somebody that's broken, that hasn't learned how to budget, that don't know how to be able to take care of children that might be entering back into their lives, or being able to take care of the stresses of paying bills or working a 9-to-5 job or a second shift job, learning how to schedule and budget. All of those things go along with not just placing someone in the house, but again, continue that walk alongside to help them be able to flourish in this new life that they have now. The thing about this is humanity and dignity in a time of crisis. We envisioned that we want to open back up our weekend kind of care program because it helped with the transitional part of when intake is not available Monday through Friday. We had a 72-hour hold period at our space in our brick and mortar in Milwaukee, but we lost funding for that. That was a critical point for the ladies that we were working with on our street outreach program that allowed us the opportunity to know and understand that we are absolutely doing our job to be able to help those that are in the process of coming out of the street into such a better place where they're able to now understand that not only did I meet you where you were, I taken you to a place where it could be comfort for you, and now I'm warm transferring you into a place where you can thrive and be rooted in, and I still have contact with you along the way. So we don't drop off and leave. We warm transfer and we stay a while, and we leave our lines of communication over. This call to action is emphasized because we love to invest in the transitional permanency of housing. Without safe places for our survivors, we face exploitation to continue as an open door and a format for survival. Training and awareness is important. Each touch point is important. Just by seeing all the people that were invited to come back and speak again on this topic shows us that it's still very prevalent. Even though the numbers have decreased or increased in ways, we still know that for every person that comes out, there's one person that's waiting in the back room for somebody to bring in. This chain needs to stop by finding the root cause of the buyer, of the person that's actually doing the perpetrating, and not just the victim approach. We have to tackle this at every realm, because every time one person is moved out the equation, whatever that is, somebody else has moved in. Our teachers and healthcare providers, law enforcement, and nonprofit leaders all have a role to play in preventing trafficking and supporting survivors. Highlighting Fresh Starts programs is one part of it, but being a part of a multidisciplinary place where I'm invited in and other survivors are invited in to give what's happening from the street in real time, because we're out there twice a week hearing what they're saying, why they don't want to come in, why this has been a fight, why they can't continue to thrive in a place where we say, well, we gave you everything that you needed to survive, which is you didn't teach me how to maintain it. So we have what's called a trauma bonding education, how to break the cycles of trauma bonding. the flags of exploitation instead of tackling this after they've gotten in, that awareness piece of the naive part of the green light where everything is open to interpretation. I don't see the dangers yet. Letting our children know from the age of 11 to 17 years old, we know the average age is 13, but they're getting our youth in elementary school because there's so much access to social media. Life coaching after trauma. When they come out of group homes or aged out of foster care, there's a need to have life coaching after trauma. Family reunification, bridging those bridges back from the tear that actually happens with families, and sometimes with families being the perpetrators, now how to rebuild new in communities. Our trainings are definitely solution-based and designed to equip professionals with tools they need to recognize the response to prevent trafficking in every specific field. Why does this matter? Our approach brings together nonprofits, for-profits, governmental agencies, faith-based organizations, community advocates, MPS school districts, unified for a united front for our victims and families to understand that we're here with you for every warm transfer. Our collaborative approach highlights the importance of community-wide involvement, from outreach workers to policymakers. By aligning our efforts, we create a net of protection that ensures that less people fall through the cracks. I want to do a brief reflection of the thousands of lives that impacted programs like the Sober Living opportunity we had to work with women. We just graduated women on November 9th that came out of the tragedy of exploitation in various ways. We also want to make sure that we highlight again the importance of our weekend care and our direct services efforts. We want to emphasize again how Fresh Start Learning is a faith-based message and hope to restoration. We believe in meeting people where they are, showing them the love of Christ and helping them rebuild their lives with dignity and purpose. I just want to close with this inspirational quote from myself as a survivor. I know the power of awareness, the importance of prevention, and the strength of community unified action. Together, we can create a world where trafficking has no place and every survivor has a chance to thrive. Our call to action is just to bring together a part of this transformational work, whether through advocacy, collaboration, or simply sharing the message of every effort makes a difference. Thank you for your time and your commitment to ending human trafficking. Thank you, Senator Johnson.
Thank you so much, Nancy. Your advocacy and your journey not only highlights the complexities that we face when dealing with human trafficking, but it also highlights the importance of making sure that we support women as they come out of the trade. So thank you. Next, I would like to introduce and welcome Asia Jackson of the Human Trafficking Coordinator. She's the Anti-Human Trafficking Coordinator at the Department of Children and Family. Asia leads statewide initiatives to support services for youth at risk of experiencing sex trafficking. She also brings a wealth of experience from her work in case management and advocacy for survivors and crisis support for domestic and sexual violence victims. With degrees in social welfare and the criminal justice system, Asia's expertise continues to guide critical efforts in Wisconsin. So thank you for joining us, Asia.
Absolutely. Thank you for having me. I rarely have to go after Nancy, and I always see people who have to go after her, and everyone's like, I don't know how to follow that. And today it's me following that. So thank you, Senator Johnson, Representative Emerson, our friends over at MPD, and Nancy for all that you've shared so far. Again, my name is Asia Jackson. I'm the Anti-Human Trafficking Coordinator here at the Wisconsin Department of Children and Families. And I have been in this role for about 5 years now. As mentioned, I come from the direct service world, so doing direct support for survivors of sexual violence, domestic violence, and human trafficking. Here at DCF, our work for anti-trafficking is situated within the Bureau of Youth Services. And the Bureau of Youth Services is a bureau that specifically supports the needs of older youth involved in the child welfare system. Typically, the programs we serve support young people ages around 12 to 23. And the service delivery system is meant to support youth and move them towards goals of safe and stable housing, academic goals, employment goals, as well as connections with positive and supportive adults. So along with the anti-trafficking program, the Bureau of Youth Services also supports our Brighter Futures initiative, which is for evidence-based prevention programs, our PATHS programs, which is for sustainable housing, again, with those connections to academic, employment, social emotional well-being, housing. We have our Runway and Homeless Youth program, which aim to reduce the number of youth experiencing homelessness in Wisconsin and also prevent homelessness by supporting the families. We have our Tribal Independent Living programs, which support young people who are currently or formerly involved in Indian child welfare, again, focusing on those goals of permanent connections, health and well-being, housing, employment, and education, but also with an emphasis on supporting and preserving cultural connection. We have our Independent Living Transition Resource Agencies, which support young people ages 18 through 23 who are no longer in out-of-home care. And then we have our Community-Based Youth Justice, in which we have a few grants within there that support the counties and supporting young people on delinquency orders. Last but not least, we also have our Youth Voice Initiative, which includes the Youth Advisory Council, which is, Nancy spoke to the importance of listening to folks with lived experience as being closest to the issue. So that's what the Youth Advisory Council is for young people ages 16 through 26 with experience in the child welfare system. There are local YACs, regionally, there are our state, but then there's also a statewide YAC, our Youth Advisory Council for young people. And then for young people involved in the youth justice system, we have our youth leadership team as well to share their experience. All of this is really important because we do know that young people who've experienced trafficking are not a monolith. They're often found in different kind of populations or agency of the work. We found that a lot of the young people involved in our Runway and Homeless Youth Grant programs, our independent living programs, have also experienced sex trafficking while under the age of 18. So it's really key to collaborate with these other bureaus or with these other programs within the Bureau in supporting young people. I want to just zoom out a little bit into a definition, just making sure we're all talking about the same young people and just really what DCF's role is here in the work. So human trafficking overall is an umbrella term that can describe both sex or labor trafficking. I like to use this model from the National Human Trafficking Hotline that really breaks it down into like an action means purpose model. As you can see, labor or sex trafficking happens when an action is taken by means of force, fraud, or coercion for the purpose of commercial sex or labor. There's a catch in there. You'll see that if a young person, so a minor under age 18, any actions are taken for the purpose of commercial sex act, that is considered sex trafficking. There's no need to prove force, fraud, or coercion. If they're under 18, that does count as sex trafficking. Might be better to understand in this way, but again, this is just the same definition. Sex trafficking is the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purpose of a commercial sex act in which the person induced to perform an act has not attained 18 years of age. Let's getting into what we're talking about with child sex trafficking. Again, the aspects of force, fraud, or coercion are not necessary because young people are legally unable to consent to a sex act. So anytime that someone recruits, entices, solicits, or advertises a young person for the purpose of a commercial sex act, that is considered sex trafficking. One other thing that's important to note is that there does not have to be a third-party trafficker for it to be considered trafficking. Sometimes there's a misconception that with the absence of, being forced or being tricked, are told something bad would happen if you don't comply, that the child is either choosing or consenting to their situation, which isn't the case at all. Some people may even describe that as a young person trafficking themselves. Not possible, that isn't the case at all. The main thing that I want you to take out of this is that that is considered sex trafficking anytime sex is exchanged for food, housing, money, anything of value, phone, gifts, jewelry. Yeah, so I just wanted to make sure we all were set on the same definition and the young people that we're talking about. Here at DCF, our grant programs do focus on young people who've experienced sex trafficking prior to the age of 18. Our service delivery model here at DCF is broken down in between 7 youth services regions. And we have a variety of grantees throughout each region. It varies on if a grantee serves the entire region or a specific subset or group of counties, but I do want to note that just because there may be some gaps in here doesn't mean that services do not exist. It just may mean it's not a DCF funded service through the Bureau of Youth Services. Typically, when I'm trying to share out the different levels of supports across the state, I usually share this. I lean on a map from the Wisconsin Coalition Against Sexual Assault, features statewide providers, and also NWS has a great list of statewide providers. But in terms of DCF, our providers provide a host of services throughout our state, including case coordination and referrals. One grantee has a call-in line that folks can call in within their region for assistance with navigation of a case or referrals. They have support group facilitation, whether that is support group for young people directly or their caregivers. They support case management. They also have caregiver support, which is new. One of the things that we found out in a previous listening session is that caregivers were also often left out of the conversation in terms of supporting youth who've experienced trafficking. We have a few grantees that provide that. And then also multidisciplinary team staffing and facilitation. That typically happens within a few grantees within our child advocacy centers. And within those MDTs, it may include law enforcement like MPD, who we just saw. You'll be hearing from Rebecca later, who is the coordinator of the MDTs, but it also includes victim witness advocates, youth advocates, and CPS professionals. Another service that our grantees are able to provide are trainings to counties and communities, as well as the ability to create tools or guides to assist county agencies or community-based agencies with identifying and supporting young people who've experienced trafficking. Here at DCF, another part of my role is training and cross-system collaboration. I don't know if you all have heard about the documentary It Happens Here, but that is one thing that I have linked right here in the QR code for you. Hopefully it works. If it does not, please reach out. I can get that link to you. But the documentary It Happens Here really leans into the message that sex trafficking happens in all parts of Wisconsin. There's not a specific area that it does not happen in. It's not just only an urban issue. It happens in rural counties. It happens in our tribes. It happens throughout our state. And it highlights the lived experience of a few survivors from our state who experienced trafficking as a young person. So in terms of training and cross-system collaboration, this training has been offered to communities through community-based organizations. We have a facilitator guide online for folks who want to have their own screenings. We've also done multiple screenings in collaboration with the Department of Public Instruction since 2020. We've hosted screenings, we've hosted training of trainers for school professionals. We've also had Nancy come in and do a deeper dive on supporting students. I believe we've had Rebecca come in and talk about building a strong team response to high risk and trafficked youth. But we're really trying to sustain that relationship with DPI, make sure that we can continue to support each other, support our educators in identifying and responding to youth. We also have had our Aiming the Game supporter trainings, which are full-day trainings where we have trainers come in and talk with professionals throughout the state about supporting youth who've experienced trafficking. Nancy's also a presenter in Ending the Game, and we have a few of our presenters from California also come in to Wisconsin. So far, between 2023, spring of 2023, and last fall, we've trained about 290 professionals. That's not just CPS or youth justice staff, that's also community-based partners. We're continuing trainings this year. We have 4 more trainings happening in 2025, and I look forward to seeing the result there. We also have a few web-based trainings on the DCF website, online modules that includes Human Trafficking 101 for professionals, as well as one for caregivers and one for child welfare professionals. The training for caregivers really is targeted at our congregate care providers. This is mandatory for them, or our group home providers. This is mandatory for them to take and learn more about the issue of trafficking. But they're also open to the public if they are non-child welfare professionals who need training as well. I don't have time to go through the data, but I do want to let you all know that we do have data on our website related to allegations of child sex trafficking made to CPS. If you visit our website and go right here to child welfare, you'll see the anti-trafficking tab, and you'll find the Wisconsin data there. If you have any questions on that data, please feel free to reach out to me. I'm happy to talk with you through it or answer any questions regarding it. I also want to share more information about our youth services homepage. Again, that can be found by visiting the child welfare tab of the DCF website. It'll be a drop-down menu that will say youth services. Here's more information about the rest of our programs, as well as direct information for young people. If you would like to stay up to date on our efforts within the Bureau of Youth Services, there is a newsletter that you can register for on the bottom of our website. And if you have any questions, feel free to email me as well. Hopefully I'm still good at time, but my email address is there. I'll leave it up for a second. And thank you all for having me.
Thank you so very much, Asia, for your insights and also for shedding light on the importance of targeted support programs, as well as all of the programs that the Department of Children and Families provides. I know that this is a very important issue for the state, and we are trying to move mountains to make sure that we provide all the services that are sincerely needed for these young people that are coming out of the trades. So thank you. Now I am pleased to introduce Rebecca Dittman. Rebecca earned her Master's of Social Work from the University of Wisconsin-Madison and currently works at the Milwaukee Child Advocacy Center. Since 2018, she has served as the Region 3 Anti-Human Trafficking Coordinator, facilitating over 150 multidisciplinary case reviews to address the unique needs of high-risk youth. So welcome, Rebecca, and thank you for joining us.
Thank you so much, Senator Johnson. So Dr. Wendy Ehrman and I are kind of doing this together. I'm going to pull up some visuals in just a moment. But I have been at the CAC for the last 8 years and the last 6 serving in a specific role for anti-human trafficking under the DCF grantee program, which has been amazing. And Dr. Ehrman is the co-chief of adolescent medicine at the Medical College, and hopefully you'll have more bio on her as well when we switch over. So let me pull up what we've got. All right. So when you know everyone else who's on the panel, you run the risk of overlapping in information. But what you really can see here is that though we all know each other and all work in the same field, we cover very different topics. So Dr. Ehrman and I are going to be focused on commercial sexual exploitation of youth. And we chose to use CSCY in this presentation to be as inclusive as possible. So legally speaking, the exploitation of young people can be defined in many ways in the state and federal law, just like how Asia talked about child sex trafficking. The Office of Juvenile Justice and Delinquency defines CSEY as the sexual abuse or exploitation of a young person for the financial benefit of any person or in exchange for anything of value, including monetary and non-monetary benefits. The office is clear to add that this includes adults sexually abusing or exploiting young people and providing survival needs in exchange. And similar to trafficking for minors, this does not require a third party. And in the work that all of us on the panel do, we encounter youth from a variety of backgrounds with many different life experiences and complicated situations. It is true that youth experiencing sex trafficking or exploitation may simultaneously be involved in like a lot. They might be in youth justice for delinquency. They may be in child welfare for a variety of reasons that are either due to family conflict or due to their home not being safe anymore. And what we urge you to take away from this presentation, especially as it pertains to any future policy opportunities that expand services and rights to impacted youth, is that regardless of youth actions, behaviors, their experiences, whatever it is they're doing, exploitation and trafficking is a result of the actions of exploiters, not these kids. All adults have choices to set and maintain boundaries to not cause harm towards minors and adult victims. And that includes things like refusing or blocking images or texts that come from minors, not playing along to suggest that adults cannot control what minors do to engage with them, or that they're somehow being tricked, that a very young looking person claims to be of age. So who are these exploiters? We do have examples listed, so if you have access to your screen, you can kind of look through those. But in short, people who sexually exploit and traffic youth really can be anyone. And it can happen pretty much anywhere. And the picture on the side here are of real people who've been convicted of sex trafficking. They come from this activity we use called Not a Number, which is a prevention curriculum, and it's currently being implemented with middle schoolers in Milwaukee Public Schools. While you're glancing that over, I want to give a little plug to Not a Number, which is an amazing curriculum. It is one of the only evidence-based comprehensive sex and labor trafficking prevention curriculums that can be used with all genders for ages 11 to 17. Nancy, also a facilitator. And it's really great. The kids engage really well with this content, even when they're 11 and 12 years old. But implementing prevention like this isn't always possible for school districts and smaller community-based services due to like the licensing costs. Or maybe people have responsive funding like me, and it does not allow us to spend money on prevention work. In 101, we often get questions about red flags or risk factors. That's like very common in shared language. However, there's a national dialogue going on right now to actually shift away from labeling victims with red flags and rather to address impacted people based on their real-time needs. So the way that we are reframing red flags and risk is to talk about vulnerabilities and protective factors. This list also comes from Not a Number, really great, and lays out for us how certain protective factors like having strong supportive adult relationships, needs being met, awareness of like what an unhealthy and healthy relationship is, and then how all of this applies to their life online can actually mitigate some of these vulnerabilities that we have here on the left. We get, though, that it's still natural to wonder, like, what is the most common vulnerability? What are we seeing? Who's being exploited? And I will say the rejection and really intense conflict that can happen within families or between a youth or a caregiver is huge. Youth who are getting kicked out of their homes, told not to come back, kids who are in youth justice and child welfare, they're in these out-of-home care placements, as MPD highlighted, that increase their vulnerability to exposure, and youth who have lack of healthy coping skills. Some youth manage crisis by running away from situations, and they're so heightened that they're willing to accept help from anyone who offers it to them and not understand what trusting adult relationships look like. And the last thing that I want to share before turning it over to Dr. Ehrman to talk more about the medical side of things is this response protocol. It originally comes from the Milwaukee Joint Protocol for Child Maltreatment Investigations. We have it as a specific addendum to talk about what we will do in instances of a CSEC or a child sexual exploitation investigation. But last year, I had an opportunity, along with Asia and some others, to do a work group through the Wisconsin Task Force for Children in Need, which is part of the Children's Justice Act, so that any county or region can access this protocol as a template. Here's just a little visual of how we make decisions on forensic interviewing, but the whole document is like 15 pages long with the best practice guidelines. And so these guidelines are centered around multidisciplinary partnerships established under county and regional child abuse review teams, which you also may hear referred to as MDTs, which is like what I'm a part of. And the document outlines each signed-on agency's roles and responsibilities in a child maltreatment investigation, including sex trafficking. This document provides best practice guidelines on everything from mandated reporting, information sharing between agencies, multidisciplinary investigations, use of forensic interviewing, medical evaluations, and how to connect young people to supportive services like mental health and confidential advocacy. We really rely on these partnerships to serve youth before, during, and after their involvement in the justice process. We know that just because a youth's exploitation ends here doesn't mean it won't happen again with someone else. And unfortunately, not all communities have immediate access to services and resources that are considered best practice. So some ideal ways that we can address this would be through expansion of forensic nurse examiner programs in more rural parts of the state, along with adequate funding for child advocacy centers and victim service agencies, many of which were seriously devastated by the reduction or complete loss of VOCA grant funding last year. And on that happy note, Dr. Ehrman, I'm going to hand it over to you.
Thank you. And while she's changing the slide, I'm Dr. Wendy Ehrman. I'm an adolescent medicine physician at the Medical College of Wisconsin, and I specialize in treating vulnerable youth. So this section is going to focus on healthcare and what we see in terms of sex trafficking involving youth in the healthcare system. So we know from a study that was done in 2015 that 80% of individuals who've experienced sex trafficking have had contact with a medical provider or a medical setting during their period of victimization. And the problem, we know that they're there. We know that they're being seen. The problem is that there's a disconnect between being seen and being recognized. So a recent study was done by one of our colleagues through the state of Wisconsin. And what she found is that less than 50% of healthcare providers could correctly identify a trafficked individual. So in other words, they miscorrectly identified them as a prostitute or a juvenile prostitute when indeed they were a victim of sex trafficking. 90% of providers and 79% of social workers in the study were not confident in their abilities to identify, screen, and respond to sex trafficking, and 95% wanted to learn more. So we know that these youth are out there. We know that they're being seen in medical care settings, but what we're seeing is that the medical providers are not comfortable with their care. So I'm going to talk a little bit about what kind of scenarios we're seeing in patient care. And I think what's important to understand is that trafficking can be experienced in several forms. And regardless of the way that it's experienced, it's all sex trafficking. And the other point I want to make is that youth go in and out of different forms of sex trafficking. And I'm going to illustrate some here in some real case examples that we've seen. The first one is a 17-year-old female. She was supposed to be living in a group home, but she runs frequently because of conflict in the congregate setting that she's at, and she feels like it's not ideal for her. She doesn't have supportive caregivers or available parents. And she needs money when she runs. Obviously, she needs money for daily living supplies and places to stay. In her past, she had been trafficked by a boyfriend, but in her current situation, there is no person trafficking her, and she is going and exchanging sex for money on her own. And she feels that this current trafficking situation is safer for her. Despite this, she still continues to access health care with a consistent healthcare provider. The second scenario is a 16-year-old male who meets another male online, spends time for several weeks chatting with him on an app, and they text back and forth for several weeks. He then arranges to go to a party with this male friend that he's met online, and while they're at the party, older men offer them money for sex acts. Parents get a hold of his phone, they look at it, become concerned by what they're reading, and then bring him in for medical evaluation. The third scenario is a 13-year-old, and I wish I could say this was one of the younger patients I've seen, but this, I think we're seeing more and more younger patients. So a 13-year-old female with a history of acute trauma and mental health issues, who again is running away frequently. Her caregiver has found her with new clothes, and she sees pictures of her on Instagram with strange adult men. Her caregiver reacts by immediately grabbing her and taking her to a relative in a different Wisconsin county. She was there for less than a day and is picked up, and the police track her by phone to a hotel in back to the Milwaukee area. She's eventually found, and mom brings her back to medical care due to safety concerns and because she wants to get her resources and get her referrals. So what are some of the common indicators that we see or we should be paying attention to in our medical practices? One of the biggest things that I look for is a history of other sexual abuse other than the trafficking. Many of the youth we see have had prior instances of sexual abuse. They may be struggling with substance use, which makes them vulnerable for a trafficker, or the trafficker may be using substance abuse as a means to keep them under control, because if the trafficker has the substance they're using and controls how they get it, they'll do what they need to. Also, youth with cognitive delays, such as mental health conditions or past trauma, can be a huge risk factor. Young women impregnated by an adult, or a young woman who is pregnant but continues to have sex with multiple partners. Drastic changes in appearance between clinic visits. And this means somebody who comes in and suddenly changes from like a normal appearance to a disheveled appearance, which might be a sign of homelessness, or somebody who suddenly comes in with coordinated outfits and jewelry who has more than they should be able to afford. As I mentioned, evidence of homelessness by the way they appear or not being able to meet their basic needs. Use of multiple cell phones during the visit, having large amounts of money on hand, but they shouldn't be able to have. And then frequent visits to emergency facilities, urgent cares, or their doctor for reproductive health needs or for testing for sexually transmitted infections or pregnancy. So what are some of the barriers we see? And we do see barriers to care, which we need to start knocking down. One of these is fear and safety issues due to their living situation. And so this might be somebody whose boyfriend is watching their kids, or their boyfriend is their trafficker and they live with him and they're afraid to be gone for long, or they're afraid that the trafficker will find out. Shame around somebody finding out about their experience and judging them. Victim awareness. Not everyone engaged in trafficking or identifies their experiences as that of a victim. And so that may reduce their chances of coming in to seek sexual assault care. Concerns about confidentiality and mandated reporting, especially if the person experiencing the trafficking is under the age of 18. A biggie, as I mentioned, is medical providers' lack of awareness or access to training. This can lead to a less sensitive interaction, improper language being used, such as prostitute, or language that indicates that the provider looks at them as engaging in criminal acts instead of being a victim. And then finally, limited healthcare options for specialized services, such as what Rebecca mentioned, forensic nurse examiners, not easily available, especially in most of the rural parts of our state. And even in bigger cities like Milwaukee, it's not always easy to access. So I'll tell you a little bit about some of the response efforts in our area that can be used and expanded to other areas of the state. We were lucky to have grant support from Advancing Healthier Wisconsin, which helped fund a project called HCAST, Healthcare Providers Against Sex Trafficking. As a result of this project, there's a website that we have that you can look up called HCAST that provides educational opportunities online as well as resources for providers or agencies that are looking to expand their knowledge of sex trafficking and how they can respond. In addition, in a collaboration with Impact 211, there is a vetted list of resources on their website that can be accessed by calling, by visiting their website, or by visiting our HCAS website to get social service agencies or individual providers help connect their patients to specific resources with agencies that have experienced providing services to trafficking survivors. There's the Advocate Accompany Act, which was the Wisconsin Act 351, which states that any hospital emergency room or urgent care that provides services to a victim of sexual assault, sexual abuse, or sex trafficking has the right to have an advocate present during all or any part of their visit. And this includes forensic interviews as well as police interviews. It's a great law. It works well. The problem is we don't have enough advocates to meet the demand, especially in other parts of the state. Connecting to sexual abuse and domestic violence and runaway and homeless programs are needed to help fill gaps in services that we have. In addition, person-centered support beyond just the juvenile justice system or the justice system in general. All these require funding and requires specialized funding to help keep them active and running. And you see the top corner of this slide is something called CRAE. That was a grassroots advocacy program out of Pathfinders that provided advocacy services at night and on weekends. It was wonderful, especially for us as medical providers, to have that added support there for victims. Unfortunately, due to federal funding cuts, they are now put on pause. This would be something that could be expanded statewide and is of critical use for these victims. So we know sustainable support relies in sustainable funding opportunities. This is important if we want to give adequate services to our survivors. So with that, I thank you from both Rebecca and myself, and we look forward to working with any legislatures to expand whatever services we can for these survivors.
Thank you, Dr. Ehrman and Rebecca, for your tireless advocacy for these survivors, and also for helping us to improve the care for these youth that are affected by trafficking. So thank you so very much. Now, our final speaker for today is going to be Jan Majewski, Director of Project Respect, a Dane County-based agency providing services to adults and juveniles victimized by sex trafficking. Jan holds a JD from Marquette University Law School and is a faculty member at UW-Madison. She has led discussions statewide to promote understanding of the issues that are faced by sexually exploited individuals. So thank you so much, Jan, for being here today.
Thank you. Thank you, Senator Johnson. I'm going to try and cue up my slideshow here, but good morning, everyone. My name is Jan Majewski, and just wanted to add to that introduction that our programs are funded here in Dane County and in the city of Madison by both the city, the county, and we also receive funding from the U.S. Department of Justice Office for Victims of Crime. I've had the privilege of serving and advocating for, bearing witness to the lives of hundreds of victims of sexual exploitation and trafficking in Wisconsin for over 30 years. And I wanted to share some key takeaways with you this morning. So let me hope this, my technology works. Okay, share. And go up to, oh, come on. I need to go up to slideshow. Sorry, I don't mean to narrate this for you. All right, so I wanted to give you a briefing, and I think it advances the comments that have been given to you earlier. So there's no systematic data collection for human trafficking in Wisconsin. But what we do have, and what I have to do in order to estimate the size of the problem, is data mine from elsewhere. And one of the places that we can say that human trafficking is happening in Wisconsin is through the Victim of Crime Act funded victim service providers. That is through the Wisconsin Department of Justice Office for Crime Victim Services. I had 3 years of data. I have not yet got to the last 2 years, which would be the 5 years where VOCA was fully funded. But again, these were the numbers that were identified in the VOCA victim service providers data set that I received from them. So the takeaway, it is happening in Wisconsin, here in Dane County. Some data from 2020 to 2023. When we say, I put it all out there because if you get a copy of this, we can talk about it later. 69, for instance, or 90 of the 2023, we'll start there, of the 175 victims were people that we felt solidly would be protected by the Trafficking Victims Protection Act. Some other folks we believe are victims, but that they might not reach or rise to a level where we can count them as confirmed victims. And then of those, in the year 2023, 14 were minors. You can see the numbers were greater in prior years. 167 in that group were female, 5 male, 3 transgender. The data is overrepresented in Dane County by persons of color and persons with disabilities. So again, the takeaway, human trafficking is happening in Wisconsin. Second takeaway, there are no simple solutions. You heard about how the needs, we need complex case management and multidisciplinary teaming. But I would add the standard. Survivors tell us that we want to provide our individual advocacy, our case management. It is provided free, but if they had money, they would pay for it. And that's the standard that we are held to, hold ourselves held to. What is complex case management? That means that the person may have multiple conditions. They may have injuries from the trafficking. They may have untreated healthcare needs, multiple chronic conditions, behavioral health needs. Meanwhile, they're also not accessing essential services. And so that could be housing, public benefits that they're available for, vocational training, et cetera. And so when we talk about case management, we talk about this task of bringing this all together with a plan that has a recovery that is designed by the victim. And then our job is to, help the victim meet these goals. There's something earlier that Dr. Erdman was talking about healthcare response. I just wanted to add, this is from Polaris. I think it's pretty relevant still, although, it isn't last year, but 33% of trafficking victims interface with a healthcare provider while in captivity. And 50% of those had 12 or more concurrent health symptoms at the time of recovery. So that's just an opportunity to identify victims there. And it is also a time where we can separate traffickers to deliver from their victims, to deliver needed information and resources. So I am all on board with supporting healthcare providers to identify and to separate victims and then call in an experienced provider. You heard some of this, some common service needs, but we heard from that really, really well from Nancy. I can't believe you don't pack. I think that's another takeaway, right? So, I was with a victim who had been recovered by the Madison Police Department at the Dane County Airport. And her trafficker was about to put her on the plane. She decided not to go and went to security. I was in a hotel with her while we were creating a safety plan, and we were playing Yahtzee. It was great fun. And she looked at me and she said, "Jan, I can't believe you don't pack." And what she meant was that this is a very, very violent and dangerous situation. I wanted to share with you in terms of trends, increased presence of force, fraud, and coercion, presence of guns, affinity-based or familial trafficking, gang-controlled use of drugs, and increasingly sadistic psychological abuse and ritual abuse. So increased violence and abuse makes recovery more difficult than ever. I want to say that traffickers act with impunity. The conditions of victims make it difficult for law enforcement to build a case based on victim testimony. And so we need to be able to facilitate bringing traffickers to justice with technology and crime analysts, especially that kind of technology and ability, human analyst ability to small municipal law enforcement. And there's a safety need for anyone working with victims as well, and a need for experienced supervision. And I stress that whenever I talk to ER nurses or SANE nurses or other victim service providers, that you need experienced supervision. Legislative solutions, I'm going to go through this really quickly and not talk through the whole slide, but enabling the expungement of criminal records, essentially to expand the current expungement provision to include all offenses where victims were induced or compelled to commit crimes. That would really remove a barrier to jobs and housing. To enact the safe harbor law and undertake a study to determine how to fully fund it. So that would then call for the removal of juvenile prostitution from the statutes to make Wisconsin law consistent with federal law protecting juvenile victims. But we need to know what it would mean to fully fund that. And so when we have these youth now, early on in particular, involved in CPS, no longer having to be arrested to have their service needs met, what would it cost statewide to fund that? Require and support funding of sex trafficking prevention education in all schools that meets state common core standards, and including teaching healthy relationships and boundaries. Dr. Ehrman was mentioned, or maybe Rebecca mentioned, what I would further discuss is intergenerational relationships. I still find that even at this point in the work I am doing, young people still want to talk to somebody older. They want healthy, appropriate intergenerational relationships. With regard to enhancing and building on DPI's efforts, this particular legislative suggestion is calling out the need to support small school districts, rural school districts that have less funding. And so we are wanting to support small school districts in their prevention education. Let's see. This is one that is really important. We have had adults with developmental disabilities whose cases for trafficking have been not brought up by prosecutors because they're over 18, they're looking for elements of force, fraud, or coercion. And so we want to ask that when a victim has developmental and intellectual disabilities, to eliminate the force, fraud, or coercion standard for those over 18. We also want to call for specialized victim services and training for law enforcement and school staff. I'm going to scoot over these quickly, but these are some examples of that acknowledge the ability to acquire skills, but the need for an extended time frame in order to, securely train somebody and for somebody to learn these, for example. And then also training to law enforcement and school districts to be able to adequately screen juveniles for trafficking. I'm going to keep going. Just host homes, especially for those that have great ideas from survivors, and helping them meet the standards, and supporting youth shelters and assessment centers. And I got through it, Senator Johnson. Thank you so much for having me, trying to just kind of do a real quick briefing. Thank you so much.
Thank you, Jan, for all of your work and for reminding us of the complexities of human trafficking. Unfortunately, we are out of time and we don't have time for questions, but I want to thank all of our panelists for their invaluable contributions, for helping us here in the state legislature gain a better understanding of human trafficking and what our survivors need, not only to survive, but to thrive. And for all of your recommendations, those are extremely, extremely helpful in the state capitol. So I encourage everyone here to continue to follow this issue, engaging with your communities and advocating for change. Together, we can support survivors and fight back against human trafficking in every county of our state. So thank you so much for your time and for spending it with us today. Have a wonderful rest of your day.